This is the second installment of the tutorials for new user of Maestro 3D Ortho Studio. Here we're going to open an existing case, which by the way can be looked for by either the patient's first name or the last name, so that I can enter, let's say, a first letter P and press enter, and this offers everything that has the P in the record. Patient Z is the patient that I'm looking for. I'm going to click on that. This is the case that was saved just recently for this patient. I can select that and choose next. And here are the models as they come in for patient Z. That's the patient that we worked on in the part 1 of my introduction. Now, these models, when they came in, they look a little askew. So when I ask for a head-on view of the models, they appear to be somewhat downward looking and somewhat to the patient's left. Now, that indicates to me that the local origo, or the spatial orientation of these models, is not correct. That is something that can be corrected by going to this button right here, Change Local Origo. And we're going to want to change that. And here is my local origo. I'm going to turn off the 6 views of the models that tend to crowd things a little bit. So I'm going to turn it off so that we purely see just the models and their correct orientation. You can see an assortment of circles and arrows here that will help us to properly orient the model. The correct orientation for the arrows is as shown on this diagram here. The blue is to point straight forward, the green is up, and the red is to patient's left. The general orientation of the pointers is correct. The green is up, blue is pointing forward, and the red is pointing to the patient's left, but they are not exactly in the right place. So I'm going to make some adjustments. By pointing at the pointer, I highlight it, and that allows me with the left click to grab it and pull it up. When I turn the model sideways, I can see that the green circle representing the occlusal plane is off somewhat. In order to bring it down into a more correct orientation, I can highlight this red circle and turn the occlusal plane until it's properly aligned relative to the upper. I can also pull it up just a little bit more. I can turn the models for a better view, and what I see is the shadow of the red circle falling right here on the model, and it really belongs between the 2 central incisors. So I can highlight this circle, which allows me to toggle the whole structure this way and that way, and bring it to a point where the shadow falls right between the 2 central incisors. So that looks pretty good. I can further roll the models on their backs. So now I would like to see the upper model, but my view is kind of blocked by the lower. So I can switch over here and turn off the lower model and make it transparent. And that allows me to have a better view of how my planes are oriented relative to that upper model. So if there are some adjustments that I need to make, I can do that from here. So now everything looks pretty much in good place. We'll take another look at it from behind. And you can see how my occlusal plane is slightly canted. So I'm going to toggle this circle right here and adjust that. Take a look from the underside, and by pulling this up and down, I can see the shadow line beginning to engage the posterior teeth fairly evenly. So I think we're in good shape right about there. And now I can accept, oh, did I move something? I can accept that orientation of the models. And now when I choose the head-on view, you can see how the models are right, that are oriented correctly. So this local origo can be changed at any time, and really its initial presentation independent on how the models were oriented within the scanner just prior to the scanning process. What you see here is the view of the camera within the scanner as to how the models were positioned on the turntable. So the better the initial orientation, the less of a local origo error you're going to run into. Now, it is very common for uh, for some scans coming off of the intraoral scanner to be initially presented very significantly out of proper orientation as far as local origo is concerned. And I'm going to show you an example of that in the next tutorial. Thanks for watching.